How would you feel about the next US president working to extend Medicare for all? Yes, please. I'd vote for that. I don't want Medicare for all. Medicare is expensive for low-income people. I want universal healthcare where all care is free with no premium and no out-of-pocket. Paid for with higher taxes on the current 22% and higher tax brackets. I get downvoted every time, but here goes. I'm retired, in my late 60s, and on Medicare. Part B premium is $202 per month. Since Medicare only covers 80% of most medical costs, I need a Medicare supplement policy that costs $138 per month. I also need a Part D drug plan that is $8 per month. So I'm paying $348 per month for decent medical coverage, but it doesn't cover dental, vision, or hearing, and that's ** individual ** coverage. As in, per person. Ask your typical low-income household if they could afford to cover 4 persons for $1,400 in premiums per month. Yes, guaranteeing medical care and prescriptions is the least we can do in a society where CEOs regularly fire tens of thousands of people then claim $50 million bonuses for it. I feel at this point we have earned universal healthcare for the US. It would resolve so many issues. Especially your job is tied to your healthcare BS that traps you in your crappy job, especially if you are in the middle of treatment. I think it doesn't go far enough, and medical insurance as an industry should be nationalized. There's gonna be another one. Who's gonna pay for it? I'd be more happy if they focused on regulation reducing the cost of medical care for everyone. I would be fine with it, but a lot of folks may have trouble coming up with the $200 plus a month plus coparis for specialists it costs. Nope. Taxes will increase dramatically. Universal healthcare. The majority of the country would vote for it. Medicare coverage is garbage. You'd literally be cursing everyone with that kind of legislation. Medicare only covers 80%. Imagine calling an ambulance without first calculating whether dying is cheaper. As long as the reimbursements to hospitals are substantially raised so that the cost of care is fairly covered, then great. And as long as they stop denying Medicare claims over tiny clerical errors that require hours of staff time to fix, even better. Would have to come from Congress, and Republicans will never vote for it. Americans would need to give liberals and progressives over 60 senators to achieve M4A, and that isn't happening again in my remaining lifetime in this conservative hellhole of a country. I dwell in realism. I'd feel great about a president working, period. I have a friend who works a full-time job for a surgery center. She needs surgery and can't afford it, even with insurance. It's a disgrace. I would vote for that. Yes. Please, and cut military budget and greatly increase funding for research, infrastructure, education, clean power, labor protections, and social safety nets. We make America great by investing in ourselves and the future, not by trying to recreate 1957. I think I'd personally love it. I think what you've already seen in these comments, and what we saw in 2020 during the Democratic primary, is that a lot of people have very different views of how you get there and what that means necessarily. It'd be a good start. My top issues for the next election are 1. Hold this current administration accountable. 2. Further clean energy initiatives. 3. Medicare for all. That would be great. A step in the right direction for sure. Why should all Americans not have health insurance? What a joke. We should have had this 30 years ago. Yes, please. That is definitely something worth voting for. Yes, I would love that. I would be very happy with that. Probably a bad idea. The problem with American healthcare is the weird distortions caused by the threesome between the users, the insurance companies, and the healthcare providers. All of them want to squeeze as much as they can out of the other two and don't care how much it hurts the others. If we want the government to pay for healthcare, we need the government to actually nationalize the healthcare providers, or else they, taxpayers, will get exploited by the for-profit hospitals. I don't usually trust the government to run things, but our healthcare system is so screwed up that it's hard to get much worse, so nationalizing would be the lesser of two evils. Extending Medicare for all in a naive way is probably one of those few ways that would make it worse though. I do not need more government in my healthcare. You just think insurance companies push you out of the hospital. Wait till live free healthcare. You'll be run through like cattle getting vaccinations. Trump's regime has rotted everyone's brains. It gaff because that isn't the president's job. Now ask the same question, but replace a next US president with your next congressional representative but that won't get the clicks or upvotes, so it stays like this, stuck in perpetual stupidity. Let me sell my healthcare stock first, and then I will be in favor. Just kidding, I don't hold healthcare stock because I don't think healthcare should be a for-profit business. I also don't hold oil or tobacco for similar moral reasons. The next president needs to run on a second Bill of Rights, including universal healthcare, universal education, universal food for children, universal maternal and paternal leave, higher accountability and standards for all elected government officials and government employees at every level. Running on free stuff gets votes and there is never a follow-through. It's not free. Never is. Speaking as one who's experienced the utter relief of not having healthcare tied to a job, go for it. Do you mean Medicaid? All people don't get Medicare. It's for older people. Tax the cunting billionaires. Remove the cap on Social Security. Universal healthcare and Social Security for all. But that would never in a million years happen, because dumb fucks still vote Republican. I would love it. The least they could do is roll back the age a bit considering how bad the employment market is getting, especially for older people who are getting laid off and can't find comparable employment. That's pretty fucked up. You're 55 years old, 10 years away from Medicare, and suddenly without health insurance and no one wants to hire you because you're too old. It's fucked up. Medicare pays doctors and hospitals 20% to 40% of total bills. If everyone was on Medicare, few would go into medicine and there would be much worse shortages of healthcare providers than there is now. It only works now when a larger portion of patients pay the full bills through private insurance. I would love universal healthcare. And also free breakfast and lunch for all school kids. Killdeer here, how would that possibly be funded? Don't go down the path, if corporations and rich paid their fair share. This is about as likely to happen as Medicare for all. Who is going to lay for it? I would be all for it. What's the point of this karma farming or engagement bait? Every Redditor with a pulse would feel good about it. No need to discuss. I would wish them luck. We need it, but there are too many billions of dollars working against it. Every health insurance company would be out of business. That alone puts several huge companies and all their money in direct opposition to anything even baby stepping toward universal healthcare.